on the car ride home. I was freaking out. My mother is probably going to kill me after she watches this video. I don't even know how to put it into words, but oh my god, what did I do? Hey guys, so I'm gonna do a video explaining how my first day went. I'm currently walking back to my associated hospital. Yesterday was awesome. It was amazing. I am on pediatric surgery now. Completely different hospital, completely different medical record system, completely different badge. So I come in at 5 a.m. 5 a.m. to 5 p.m., sometimes 4 p.m. shift, so regular 12-hour shift. But yesterday I went into clinic with one of the physicians, and he is just beyond great. Like, loves what he does, great at what he does, and most importantly, loves to teach. I love being with physicians who love having students. This physician let me go into clinic, see his patients, get a nice history from them and present it to him. He also had undergraduate students with him, which is amazing to have that kind of experience as an undergrad. And they even got to go to the OR with us, which is like incredible because I haven't even been to the OR like until I was a third year med student, and this is like a freshman and undergrad and who's getting to get this experience. It's great. In surgery, there has been no dedicated time for eating lunch. You just find a couple minutes and you basically just scarf whatever you can down your throat. The doc I was with yesterday was like, is anybody hungry, because the OR is almost ready? And I was like, yeah, I need some food, because I'm just being honest, like I'm gonna need some food. And the undergrad students agreed with me, so he like took us to the cafeteria. We got a granola bar. He got like 2 protein shakes, and we scarfed them down in like 5 minutes and then ran to the OR. In the OR, like, the physician was just amazing, very relaxed, let me do some, cutting with the scissors. But he like explained every single step to me, and I love when that happens, because usually when I'm in the OR, I'm just like, what's going on? Where are we? I'm not oriented whatsoever. Hey guys, it is December 22nd, and it is my last day of surgery, and I am beyond excited for this day. Oh my god, you guys, I am officially, well, not officially, I still have my exam. I am done with my surgery rotation. I have been so emotional. I was crying on the car ride home, leaving the hospital, because I don't know, this experience with pediatric surgery has just been phenomenal. This has been the best rotation I've had so far. And the physicians, I don't think they understand the long-lasting impression that they left on me. I have just had, I don't even know how to put it into words, but it's been an awesome 3 weeks. I don't want to do pediatric surgery, but it just goes to show like how much of an impact a attending or a physician can have on you, even though you want nothing to do with a certain specialty, or it was never even on your radar. It's been a great 3 weeks. It's been a long 6 weeks. Tomorrow is my official day where I will be officially done with surgery. And as promised, I'm gonna talk about the pilonidal cyst surgery, which is something that I posted on my Instagram account. So again, that is a kind of like an infected cyst or a hair follicle that's kind of in between or right on top of like the, I guess, butt cheek, and or the butt cheeks, where they kind of come together to form like your butt. Right there in the middle, it's like an infected hair follicle or an ingrown hair follicle. And so what we did was we placed the patient on their backside. They're obviously intubated. For that cyst, we kind of like use this, I don't know what it's called, but essentially you can dig out a circle where the cyst is. You like screw it in, and it takes out a chunk of skin, and it kind of pulls out that whole area so you can get the infected hair follicle out. And essentially what we did is we got like some, not tweezers, but little clips, I guess, like they're called hemostats. Then we go in there and we kind of just chuck away at the skin, and there's a bunch of hair in there, and you just get it all out, and you just pluck away. There's going to be some fat in there as well. It's just like a deep hole. If you ever have a blockage somewhere, behind that blockage is going to be infection. I basically did the entire surgery on my own with the help of a resident, and the attending physician just sat there and told me what to do. And of course there is like some bleeding, so you get gauze and you kind of stop the bleeding. You just want to pack it with more gauze and then let it heal by itself. You don't sew it up. It's just gonna be packed in, and then the skin will gradually heal on its own. It'll leave a scar. But now I'm gonna share with you guys a couple of pearls that I learned throughout my surgery rotation. So first one is don't be afraid to ask for help, especially like when you're in the OR. Ask your resident, ask the intern. And I found myself needing a lot of help while I was on the rotation. I was always asking questions. Other pearl that I have is don't be afraid to do things. I know being in the OR, I was always afraid to touch things, do anything, because I was afraid of making the sterile environment unsterile for touching something that I wasn't supposed to touch. And even on my last day of the rotation, I kind of messed up and touched something I wasn't supposed to touch. That's the way you learn. Notice that once I took initiative more, I was able to gain confidence. Hey guys, sorry, I had to move into my room because my phone was dying. So my last pearl for you guys is a little bit of a story. If you know me, you know that I wear a very special ring on my finger that was given to me by my great grandma. It was her sister's. It's a gold ring with a emerald stone in the shape of a heart. I've had it on me for years now. It's very special. And it has a lot of meaning to me. When you're in the OR, you have to take everything off of your wrists and your hands. So no rings, no watches, no bracelets, nothing like that when you're doing surgery. So a lot of surgeons, what they'll do is they'll put their ring on a necklace here. You can see, you know, usually their marriage ring there. They'll tie it to I've seen people tie their Apple Watches and rings to their scrubs, which I think is really dangerous, because when you take those scrubs off, what if you forget the ring is tied there or something, you know? I had my grandmother's ring on and I've been wearing it, and I'll put it in my scrub pocket here on my chest, which is also very stupid and very dangerous, because once I'm off my shift, I rip my scrubs off, put them in the laundry basket, and there it goes. One Friday, and Fridays are short days for me. I usually go in and leave by 12:30 because I have class in the afternoon. I remember this one Friday, I went home like any other day, and then Saturday morning I came back. We were rounding on patients. There's this one patient who was like making hand gestures, and I saw he had a ring on his finger. And I was like, I have a ring too, like, okay. And then I looked down at my hand and my ring is not there. Immediately my heart sank down to like my feet, and I was like, oh my God, I must have left it in my scrubs from yesterday. I started panicking. Leaving your ring in the scrubs that gets thrown down to a bigger pile of all the other hospital scrubs is like, say goodbye to the ring, like you're not gonna find it. I told my chief resident, I was like, hey, left my ring in my scrubs. And he was like, okay, well you can go check. I went down to like the changing room, looked in the hampers, checked all the scrubs, nothing. The scrubs were taken from yesterday to, they emptied the hampers, obviously. I was like, oh my God, what did I do? I was freaking out. My mother is probably going to kill me after she watches this video, because I did not tell her. I called the cleaning linen place and I was like, this is what happened. This is the ring description. This is my number. And he was like, okay, yeah, we usually have people, this happens. They leave their glasses, they leave their phones. But this is a ring, okay? This is small and it's real gold. It's like very special. And he was like, I can call the company who cleans our scrubs. Like, they come and pick up the scrubs. We don't clean them in-house. So I freaked out even more. And I called the scrub place, and even let them know. And I saw online that they clean the scrubs for like basically all of the hospitals in the state of Indiana, which is a crap ton. I called all of the surrounding hospitals. I was like, if somebody finds this ring in the scrubs, because the company basically washes the scrubs and then disperses the scrubs back. I don't know. I was like, maybe the ring just stayed in the scrub pocket and like somebody will put on the scrubs and find the ring in there. So I called a crap ton of hospitals and I was like leaving descriptions. This is my number, please call me back. And I would call them a tremendous amount of times and check in. Did anybody find it? This is my name. I left my number. I even called into my hospital more than others. They kind of got tired of me. And so a week passed by, nothing. No one has found the ring. And I was in a state of depression. Couldn't believe how irresponsible I was, because I knew in my mind that I should not wear the ring to work, but it's just always on me. It's kind of like a piece of me, and so I just like forgot. It was hard to come to terms with the fact that the ring was gone. I cried. I was like very, very sad. Didn't want to get out of bed. This ring meant a lot to me, and I just couldn't believe. I didn't know how I was going to break this to my great grandma or my mom, because they always see it on me. And so the fact that it was not on me, I feel like when I would go home, they're going to notice. So moral of the story is, do not have any valuable things on you when you're on your surgery rotation, period. Just take it off on orientation day. Leave it at home. Don't ever touch it. And don't ever put it on until you like are in a different rotation, okay? Because I do not wish that upon anybody. The story goes on. So I come home from the gym one day. I see this round, shiny thing at the bottom of my desk by my door. And it's a silver thing. It's a gold thing on the floor. That's what it is, guys. It's my ring. It's my ring that I was calling everywhere for. I don't know how it got there, because it was like in a place like by my door. I don't know how it got there or what, but it was legitly a miracle. I feel like that it was just lying there. I was ecstatic. Like, my Christmas wish came true, because I was so depressed over Thanksgiving and I was heading into the holidays without my ring. I'm beyond lucky that it popped up. Pediatric surgery was a blast. I recommend everyone signing up for pediatric surgery. Pediatric surgery, when I was going in, I was told that, oh, you're gonna have long hours, you're gonna have to wake up early and go get numbers, and just like really bringing it down. Every time I went in and worked with the physicians there, they made me want to be a pediatric surgeon. When I got home every day, I had to take a step back and be like, okay, Jasmine, do you really want to be a pediatric surgeon, or are you just having a great time here with the people? The answer was, I was having a great time, but I don't want to be a surgeon. Yeah, your hours are long and you have to get numbers. I like getting numbers. I noticed that if you're working with kids, usually these doctors are going to be really great people and like really nice and very patient, because you need to have patience to work with kids. There's one doctor, Dr. Gray. I will never forget this doc. He gave me so much confidence in myself in the OR, out of the OR. He would always look for ways to explain things about what's happening, because when you're in the OR, I don't know what the hell's going on. Like, I don't even know what body part this is. I mean, it's very easy to get lost and just stare at the screen and be like, okay, like, sure, that's what I'm looking at the freaking stomach right now. Like, what I did to prepare for the shelf exam. So I don't have the book with me because I gave it to an underclassman already. It's called Pestana's Surgery Notes. It's on Amazon Prime, maybe about $50. Short read. It doesn't have the details that you're probably going to get tested on, but it is still a good read, and it gives you like at least a good base to start off from. The rotation gave us a schedule of what chapters we should be reading each week. So it was about maybe 2 to 3 chapters a week. Read the entire book. It's not long. In addition to that, I did questions on surgery and emergency medicine, because those are going to be the topics that are going to be on your surgery rotation, especially like the trauma questions. There's a surgery textbook that our rotation had us review, and those chapters are really long and the details are just really gory and like really minute. So I asked the residents, hey, like, you were just in my shoes not too long ago. Is there any tips you can give me to prepare for this shelf exam? And guess what? They gave me awesome tips. I did just fine. I did average, hopefully in the range of getting a high pass. I gotta go pick up my dog from his grooming appointment, Winston. I'll put in a picture. But thank you for listening, you guys. I hope this was helpful. Email me with any questions. If you want to hear anything else on my rotation videos, let me know. This is for you. Thanks, guys, and I will see you in the next video. Bye. Don't forget to like, subscribe.